All right, I think we're ready. So, Valerie and Myra led us in an excellent discussion about why consumer engagement matters. How do we do it? How do we organize consumer engagement options with the resources that we have? So that's what my presentation is about for you today. So I'm Kayla. I'm Consumer Engagement Coordinator here at the Council. Pronouns are she, her. I live in Nashville, and I've been with the Council for a year and a half, about. And this is my first conference presentation, so thank you all for bearing with me. So, yeah. I also want to plug the NCAB rally while folks are in the room with me today. NCAB is having a rally. They're organized a rally for us on Wednesday evening after keynote and plenary. So about 5:15, we'll all meet in the lobby and march to McKeldin Plaza. And we're going to rally for healthcare and housing justice. And I hope you're all there with us. So my presentation here today, we're going to start out with an interactive activity. So if you can get out your phones, laptops, and get connected to the internet, it'd be a good time to start doing that. The activity is going to introduce the Council's new consumer engagement assessment tool. Following that, we're going to look at options for consumer engagement. Again, we've got best practices for consumer engagement, so we're going to take a look at each of those. We've got board of directors. We need consumers as representatives on health center board of directors. We need CABs, consumer advisory boards. We need panels and work groups. We need employees with lived experience and subject matter experts with lived experience. And we need to collect information from our consumers through surveys, feedback boxes, and focus groups. That's just a few of the ways, and we're going to look at those each briefly during this presentation. And if you have additional questions or if you want to get more in depth, I would highly recommend talking to NCAB, as those folks have experience in these areas. Talk to staff at the Council. We're here to support you as you implement these things at your health center. And then after this, we're going to break for lunch, which will be on the 3rd floor where breakfast was served. Okay, let's all get onto slido.com, or you can, there's this. So slido.com, or scan the QR code. So while you're getting set up, I'm going to speak a little bit about the assessment tool. The Council developed the assessment tool to aid health centers in assessing their consumer engagement. So it's our hope that the consumer engagement activities included in the tool are happening at your health center, and that you can use the tool to facilitate thoughtfulness about what health centers are doing to meaningfully coordinate their consumer engagement. We hope to make consumer engagement opportunities accessible with people with different capacities, situations, skills, and interests. And then what the information we gather from the consumer engagement assessment tool, we hope to use that to understand the greater landscape of consumer engagement at health centers. So we're going to have all this data available for us and better understand what's going on across the nation. Slido.com. Yes. Yes, HCH 2023. If you're on the right page, it should say which consumer engagement options are familiar with you. Are you familiar with? So this is a word cloud, so as you all enter your answers, they're going to populate on the screen, so we'll be able to see what consumer engagement options folks in this room are familiar with. We got cabs, we got surveys. There we go, starting to populate. Whatever consumer engagement opportunities you're familiar with. So what knowledge are you bringing into this room? You can do multiple words. You should have the option to continue to add. Yeah, just answer the question and you'll see it pop up here. It's a word cloud, so a lot of people have answered surveys and focus groups. That's why they're shown bigger on the screen. Looks like we got about 28 participants, so we're looking good. And y'all continue to join and add your options on the screen here. All right, we got a lot. We got board of directors, we got CAVs, we got outreach, surveys, focus groups. A lot of this stuff listed here is excellent ways to get consumers involved in the work, and consumers are leading a lot of these efforts, most of these efforts, in their health centers already. So it's really exciting to see all this feedback. All right, we're moving on to the next activity. Does your organization have the capacity, meaning labor, time, funding, buy-in, to advance consumer engagement, involvement, and leadership? This is a short answer, so enter as many or as few words as you'd like about your organization. I accidentally went forward and I meant to scroll down, but it looks like we've got a lot of yeses. Fortunately, we've got a few no's. So we're all coming from different places, different capacities. That's important to keep in mind when we're thinking about what we can and can't do. All right, we've got another question coming in. In what areas does your organization seek consumer input? Got multiple choices. Services, hours of operation, budget priorities, organization's progress in meeting goals. We got other or not listed. All right, so we've got, folks are collecting information and input about services and patient satisfaction. That's good. We'd like to see all of these checked in the boxes. Patient satisfaction, yep. All right, so the next portion is a quiz. So this is it's 5 questions. They're all yes or no questions about your organization's consumer engagement. You'll have 15 seconds to answer each question. So the organization implementing the most consumer engagement options will win. I said this is a 5-question quiz coming up. You can enter your name. You can say anonymous. You can put your health center. So they're all yes or no questions. You can say yes, no. You can also say unsure if you're unsure. You'll have 15 seconds to answer each of the questions. And the organization implementing the most consumer engagement options will win. So represent your organization in the game. Okay, we got 42 people. I'm going to move forward. Question number 1. Does your organization incorporate consumer input collected through surveys, feedback boxes, and/or focus groups into its governance? All right. Does your organization provide accommodations, something like transportation, food, technology, hopefully a combination of those, to minimize barriers consumers may face when participating in engagement activities? Yes, 92%. Does your organization have a consumer advisory board or dedicated consumer governance group known by another name? Is 51% or more of your organization's board of directors made up of consumers with lived experience of homelessness? 69% said no. Does your organization have employment positions that list lived experience of homelessness as a preferred qualification? Most people said no. 50% said no. 48 said yes. All right, congratulations, Art. We've also got Michelle, 5 out of 5. Thank you all for participating. I think as obviously there's no winners or losers. We're all trying to get consumer engagement going at our health centers. It's really important that we do so. So all your efforts are meaningful and necessary. And applause, yay! That's a good question. Does anyone want to answer that? Did anyone say no and they do have a consumer advisory board? Okay.
We don't have 51%, but we have a consumer advisory board. So my thing is that of that 69%, how many do not have a consumer advisory board so we can help you start a consumer advisory board?
That's what my team's working on right now. We're helping the consumer advisory board will also provide that looking at more consumers online perspective because we're not have on the executive board and we're currently trying to start.
Yeah.
So, because, and the reason why I ask that because, like I know this group over here, that the majority of the people that's taking is trying to start consumer advisory board. So you have individuals that's here that's on the steering committee that can take and direct you to, I'm the person I always say, go to the website. Go to the website so you can see the bylaws of a consumer advisory board so they can help you start that consumer.
What's the website?
What is the website? National Healthcare for the Homeless Council. Yes.
Yeah, Paul? Yeah, thank you for pointing that out. I think HCH standalones, oftentimes they're moving towards cabs when they can't fulfill that 51%. You can get that waiver. Yep.
Consumers.
All right, so the consumer engagement assessment tool, we've got the second QR code. So we encourage folks to use the more robust version of this tool to assess your consumer engagement. It's at nhchc.org. I'm going to stop talking so you can see the URL. So the assessment tool was created to support health centers in evaluating their consumer engagement practices. We are collecting the information to better understand consumer engagement and leadership landscape as well. So it's an exercise in thoughtfulness and intentionality around consumer engagement. It can be completed by anyone with a knowledge of administrative policies and procedures, organizational governance, consumer engagement efforts. This could be board members, staff, patients, subject matter experts, or advisors. It should take around 10 minutes for you to complete as well. You're welcome to do that now. We've provided time at the end for you all to do that. And closing out this section, I want to say a big thank you to NCAB as well as the HCH administrators who contributed immensely to the creation of this tool. The full tool, they came together in work groups, and the HCH administrators piloted the tool for us and gave us great feedback. We are still implementing some of that feedback, and you'll find if you get through and submit the assessment tool, you will be prompted to submit a survey where you can provide feedback about the tool for us to improve it.
And then is everyone that's attending the conference, are they getting this?
I know we're going to promote it in other sessions.
Yeah, and it's on the website. We're encouraging people to go to the website to take it in general, whether they can go to the conference or not. So it'll be
Okay.
so I can share this. Yeah. To everyone here. We actually need about 100 people to take it. I'll ask the word.
The government wants 100 people to take it, so.
In attendance?
1,000 at this conference.
So, I mean, we should be able to do at least 10%.
All right, y'all, diving in. What are our consumer engagement options? So I really appreciate all of the expertise in this room. I think a lot of the folks here were consultants on Meredith and I's projects, the assessment tool, and the consumer engagement online course, which I will be able to speak about more at the end of this presentation. Woo, woo. So consumer representation on a board of directors. It's a practice that brings patient perspective to decision-making about executive leadership, like selection and dismissal of the CEO, personnel policies, health center activities, financial policies, legal compliance, operations, really big picture stuff. So why is this an important option for us to explore? Consumer representation on a board of directors is an evidence-based health center governance promising practice. Decision-making informed by patient perspective has the power to bring improved outcomes. It's necessary because it is in line with the human rights approach to decision-making. No institutional level decision-making should be made about consumers without their direct participation. To recognize lived expertise is to recognize the valuable and irreplaceable contributions of people experiencing homelessness in this work. Consumer representation is a consumer engagement opportunity that can improve individual skills and contribute to professional development. Some tips for success. Recruitment. Recognize and value patients who are a voice for their community. We need to look for people who will not be distracted from personal goals as a result of their participation. Look for someone who is an advocate for others, who can recognize social and cultural norms. Look for someone who has the time, the energy, and the capacity. Recruit someone who's passionate about the mission of your agency and someone who's familiar with your agency. In recruitment, we need to understand the barriers that patients face, patients who have lived experience face, and we want to remove those barriers wherever possible. To remove those barriers, it's important to make expectations clear, explain what it means to be on the governing board. Organizations should also manage their own expectations. Recognize that folks must tend to their basic needs, health, and well-being first. Remove barriers by providing technology, transportation, childcare, meals, compensation. Not necessarily board of directors compensation. That's a voluntary position. It's really important that we conduct an interactive onboarding orientation for consumer members of our board of directors. Don't just hand off a big binder full of information. You should explain expectations regarding the mission, ethical standard, time commitment, and the specific consumer role. Incorporate mentorship in your onboarding process. Mentorship is a huge part of the NCAP community. They execute this very well. Mentorship is connecting emerging leaders with someone with experience. So they should have someone who they can direct their questions to. It's really important to invest in continued success, so we can do all the onboarding and we can do good recruitment, but we have to continue this practice of supporting our consumer leaders. They'll offer training opportunities, professional development opportunities, and continued support. Last but not least, we must value consumer issues and consumer input. It's one thing to bring folks to the table, it's another thing to listen to them. So if you say you're incorporating consumer voice in organizational governance, mean it. Clearly communicate how consumer issues are being addressed and how input is being utilized. Be transparent about how your decisions are being made. Consumer advisory boards. So within the Healthcare for the Homeless community, a consumer advisory board is a group of people with lived experience of homelessness who participate in services at their local Healthcare for the Homeless program and come together to improve their health center. Groups of consumers that consult use a variety of names. The idea of a CAB is that it serves as a platform for members to inform staff and governing boards of the needs of people experiencing homelessness and to advance the way services are provided. Members of these groups serve as community representatives and advisors regarding policies, practices, and services provided. We've got 3 whys for why have a CAB. CABs facilitate the creation of the most effective policies and programs via direct input from consumers. CABs uphold consumers as partners in the work by providing meaningful opportunities for leadership and decision-making. CABs can also support the development of consumer leadership. So tips for success. CABs are not a staff-led space, but they should be connected to and supported by staff. So this means a staff liaison or someone working in patient or client relations can help the CAB. They can set up meetings, they can provide accommodations, meeting space, facilitate communication between the CAB and organizational leadership. Good practice for CABs is to create a clear and powerful mission, and also they may establish their own bylaws. CABs and staff should absolutely utilize the expertise and resources created by NCAB throughout the years. So NCAB, you can reach out to them for technical assistance starting up your own CAB. Another option for consumer engagement is panels and work groups. So a consumer panel advises on a specific topic or project or program, and its members are constant, and they disband whenever the work is completed. The work group is similar to a panel, but the members are engaging more directly in a project or assignment and may contribute to additional tasks beyond advisement. So our involvement with work groups for creating the assessment tool, for example, folks were testing things out and they were contributing their expertise in a variety of ways. So the panels and the work groups of consumers and consumer subject matter experts allow us to approach big projects and know that the work is going to be done well, and it's going to be done in a way that's informed by the community of those served. Panels and work groups are a wonderful way to bring people together. It may lead to future collaborations as well. And again, in my time at the council, I've found that working alongside consumers is a great way to bring people together. We do hard work. It's not always easy to just hop on a Zoom call and get through even an hour-long meeting. Sometimes it's, it can be really hard. Myra's, yes, it's work. And so we got to compensate our people appropriately. We got to make sure that you did a great job is affirmed and that we're equal partners in this work. Our panels and work groups, again, support consumer leadership. So tips for success with panels and work groups is facilitate good collaboration. So this is something that all members contribute to of the panel or the work group. Principles of good collaboration are honest inclusion. Honesty is a best policy. Considered communication, action from day one. So what are we doing? How do we accomplish it? And then we're going to try to simplify complexity. It's how we best collaborate, is to take this big nebulous thing and make it into actions. get the work done. Another good practice for panels and work groups is to establish equality in partnerships, so all members are valued for what they bring to the table. It's important that we listen to and respect each other's voice and perspective, especially if people are bringing non-traditional ideas and concepts into the work. We want to respect it and consider it fairly. Finally, we're compensating people for the work that they do. All right, so another option we have is employees with lived experience and subject matter experts with lived experience. Lived expertise. So our consumers, we work alongside them and they work in roles that explicitly include lived expertise as a preferred qualification, and there's also roles that don't necessarily say lived expertise in the job description. Employees and experts can bring their lived experience as a way to bridge the gap that often exists between providers and people experiencing homelessness. For example, outreach workers who have lived experience can support patients to engage with health center teams, can bring people in, say this is what the health center does and this is how it can help you. And this can lead to medical assessment and treatment at a quicker rate. We know workers with lived experience are better equipped to understand the struggles of people experiencing homelessness and help serve in ways that other providers cannot. Inclusion of staff and experts with a variety of backgrounds and lived experience benefits everyone. We want to bring new ideas, practices, and skills into our work. I forgot to animate my slide, I apologize. So again, bridge the gap, understand the struggles, and bring forth principles of inclusivity. Tips for success for employees and subject matter experts. Help employees establish clear boundaries. So it's important for staff to establish personal and professional boundaries to avoid burnout and create safe and productive working environments. Employees benefit from supervision that's trauma-informed. Staff who are working alongside consumers and folks with lived experience should look for signs of burnout and respond with support. Again, we want to create room for non-traditional ideas. We want to encourage fresh perspective and be open to implementing these ideas. Subject matter experts are vastly important to our work, but it's hard to keep track of everyone. So we recommend subject matter expert databases. So utilize that and bring forward folks who have the appropriate expertise into your panels, work groups, and other activities. It's going to be short-term, long-term work. All right, the final option I'd like to discuss is surveys, feedback boxes, and focus groups. So recommendations can be collected using these three forms of gathering consumer input and feedback. So surveys, they're a good tool for collecting information about patient satisfaction, for example. It can be collected on an ongoing basis for quality improvement purposes or for research. So the National Healthcare for the Homeless Council does the helps and or We work alongside NCAB with the CPO. That's an example of a way that surveys can be implemented.
What's the CPO?
Consumer Participation Outreach Survey. A CPO session will be what day of the week? Wednesday at 2:15. Feedback box is a simple mechanism used for evaluating programs. It can be anonymous and provides folks with the opportunity to say what they think the health center leadership needs to know. And then focus groups, it's a research method where groups of people gather to provide their thoughts about a certain topic. Health centers and other aligned organizations can host these to stay connected to their patient populations and gather information from consumer perspective. It's important to use these opportunities for consumer engagement because consumer feedback is valuable and vital to improving services. We want to make sure our services better meet the needs of community members. And again, these resources help us stay connected to our patient population and learn from consumer perspective. Tips for success. So involve consumers in all aspects of data collection. Subject matter experts with lived expertise can help formulate survey questions or interpret results. They can facilitate your focus group. Folks absolutely contribute to the process in myriad of ways. It's important to provide incentives where possible. It's important to sustain your data collection. Do it on a monthly, quarterly, annual basis. Figure out what's best for your organization. Have a plan for how you'll conduct that data collection and a process for incorporating those results. So that is an overview of some of our consumer engagement options. And as I said, that's just a brief look at what we can do, how we can organize consumer engagement options at health centers and other aligned organizations. So the consumer engagement online course was developed in partnership with Consumer Work Group. And it's a 3-part course for emerging consumer leaders. The audiences are consumer leaders. So folks with lived expertise can learn how to apply it in consumer engagement options. It's a 3-part course. So we've got history of consumer engagement, how to get started, and then what is the impact consumer engagement can have. 3 parts. Throughout, you'll get to hear from 6 experienced consumer leaders about their engagement work as well. So specifically, I really want to thank Meredith and Amy Grissett, Myra Nagy, Joanne Guarino, Patricia DeHart, Sketch Opie, Melissa Moore, and Deidre Young, as well as John Soto for your work with the Consumer Engagement Online course. All right, so we have time if we want to incorporate some discussion into this and questions into this portion. I'm interested to know if folks have questions or if they want to go a little bit more in depth. Well, we've got, I think, roughly 20 minutes left in our section. Yes, Ms. Charlotte.
Can follow along and we can speak up.
Yeah, I think that's a really good point. We find that when we work with health centers and even shelters and those, helper sort of agencies, that the primary way that most agencies like yours
engage consumers is by including them on their board of directors. That's by far the primary way we see that happen. Research would indicate that it is also the least effective because of what we've just mentioned here, that most agencies that seek to engage people experiencing homelessness do so by adding them to their board of directors, and that is typically the least effective way of doing that because of what was just said. There's information distributed that's either they can't access because they don't have the technology, that's written at a reading level or a computer literacy level that they're unfamiliar with, that includes information that's never explained to them. Have you ever served on a board of directors? Oh my goodness, it is extremely boring. I mean, really, those are the worst. Those are the worst. I've served on several board of directors. I don't open that packet. That's the worst. When do I say, hey, I think I want to look at the financial information of an institution where I don't work and I don't really know anything about them, right? I don't know about the rest of you. I feel like we're about to be attacked by a weed eater. I just think you should prepare yourself for that reality and kind of have a safety plan in your mind of what you're going to do when the weed eater noise does finally, erupt into the room. I have a safety plan in mind for myself. It involves some running and screaming. Anyway, so we have to think creatively about that fact that if you're just kind of sticking people on your board for the sake of being able to check off a box by your grant funders, that you're probably, not only is that ineffective, but it's also extremely discouraging for consumer leaders. It also reinforces stigma in your board of directors, because your board of directors comes to that meeting and go, see, they can't meaningfully contribute. Right? And then your consumer leaders come and go, see, I can't meaningfully contribute. It would almost be better for someone not to engage at all than to engage and fail. It would almost be better for someone not to engage at all than to engage and have reinforced within them, see, I knew I couldn't do this. So if that's what you're doing, if that's the primary way that you're engaging consumer leadership, you really need to think through, what are the acronyms? To be honest, you need to be thinking about that with all of your board of directors, because half the people on your board, whether they're consumers or not, don't have any idea what you're talking about, right? How effective is your board is a whole nother PCI, right? But when we think about consumer leadership, if our primary goal is I've got to be able to check this box, I've got to be able to say that we're engaging our patients, if the way we're going to do that is through our board of directors, then we've got to think about how do we make this meeting accessible? Does everyone dread coming to this meeting? Does anyone know what we're talking about? Does anyone contribute? How does everyone contribute? How do we make a common language where we're all speaking about the same thing? That's going to take a lot of work, right? It's going to take a lot of orientation. It's going to take a lot of onboarding. And then if that's not working, what are other things that we can do? And that's what Kayla just described, right? There are other things that we can do that your funder, regardless of who your funder is, may say, you know what? We're going to give you a waiver. You don't have to have 50% of your board, but because you're doing this. So some of you have already mentioned the desire to start cabs. It used to be that when we would have a meeting like this, the only form of consumer engagement that we talked about was cabs, consumer advisory boards. And then HRSA, the health... Yes, thank you. I've used the acronym so long, I don't even know what I'm talking about anymore. Is it health or it's health? Health, yes. I'm just going to say the government, the government. Came to us and said, you keep talking to health centers about cabs, and we keep having health centers coming to us and saying we can't do a cab, so I guess we can't do anything. So that's why we're really exploring these options around panels and work groups and lists of subject matter experts, and how can we help you form a cab. But if you can't form a cab and we can't invest in the bylaws and all that, we just don't have the staff for it, what can you do? So we're hoping that this session helps you to dream about, okay, if we really can't do that right now, what can we do that's genuine? That's genuine. It doesn't just check something off the box, but something real is happening. And patients are coming to meetings and they're speaking up like you all did this morning, right? Like you all did in the last session. This is what I think. This is what's hard. This is what we stand for. This is what's important to us. And someone's listening and someone's acting and there's community happening, right? That's what we hope you do when you hear all these different suggestions, is that you dream about what could we do? What could we do? If we can't do a cab, if our board of directors isn't working, what could we do? And a lot of it's going to be coming down to having common language like that. Go ahead. Did you have the mic?
Thank you, Cindy. You pretty much answered my question. I guess my next question would be, how big should your cab be, and what percentages, and I guess that's referring to the bylaws, if any, could be employees, and could be consumers. And if we do pay them or compensate them, does it have to be financially, or could it be any type of gifts or food or anything like that?
So to answer that question, for our cab, we have anywhere from 7 to 12. And that's been changed a couple times due to the fact of depending on how COVID had happened. So right now, we have a total of 13 people, which a couple are new ones that are being recruited. What has happened is that some folks still do Zoom, and they still get a small $15 gift card for staying home, because they don't want to transport, and it's at night, so that happens there. But the folks that do show up, they also get a $15, but they also get a meal. So what happens is they sort of kind of get this double incentive. For some of us that don't want to be out late or just getting off of work, we'd rather stay home and get that one incentive. And there's a few of us that do that. The ideal, what they always say is have that even plus one. So there's always that one off, that the boat may change one way or another, but it's always been that I've seen in a couple of the cabs that we have from our county to our city to our state, and then in our HCHs, has been the most that I've ever seen is 30 members in their cab, their little community cab, and the least is 5. So it just depends on how many you actually want to make, but also your budget and how it's written in for bringing folks to the table, feeding them, giving them a small stipend, or even transportation stipend, if they're not using their own vehicles and stuff.
I'm going to go to David and then to Valerie. Short answer, I think, is bylaws, like what Art said as well. I would agree.
Actually, I got even a shorter answer, our Consumer Advisory Board Manual. So I'm David Peary. I'm one of 2 co-chairs, along with Paul Tunison of the National Consumer Advisory Board. That's an excellent question that you asked about the composition of the cabs. So we have produced a resource called the Consumer Advisory Board Manual, the CAB Manual, that we spent several years of revising. It was originally published by the original Ellen Daly in 2007, I believe, 2003 or 2004, shortly after the National Consumer Advisory Board was formed. And we spent, a year and a half, 2 years, was it, Deidre, revising it. And we significantly revised the CAB manual, 3 years. Okay, we put in a lot of blood, sweat, and tears, and I emphasize the blood and the tears, spread all over it. But we spent a significant amount of time. So those questions are all suggested and recommended. We have very few absolutes within the manual, because you need to adapt your cab to your local circumstances. So there's no correct answer for all circumstances, but you can adapt it to your local circumstances. So go to our cab manual, and that will be an excellent resource.
NHCHC.org. We talked about that this morning. NHCHC.org. If you're looking at the home page and you look up on the top right, you're going to see 3 little groups of our steering committees, and there's one that says NCAB, NCAB. If you click on that, that will take you to our National Consumer Advisory Board page, and there's a list there of lots of just amazing CAB resources, and one of those is the CAB manual. However, you can also go to our homepage, nhchc.org, and put in CAB manual in a search, and that will come as well. I'm going to go to Valerie, and then I think Kendall, and then probably lunch.
So I think I heard you say something about staff. So I'm the staff liaison for the CAB. One of the things that I can't do, I got to wear one hat. I'm staff. My job, my responsibility is to make sure that they have everything they need to run the meeting. My job is not to interfere, because to me, I am strong on consumer leadership, consumer-driven, and the voice of the consumer. So if I'm working for the organization, I don't get to chime in whatever it is that they're talking about, even though I take the minutes, I make sure they have the food, and I make sure their transportation is available to them. So be real careful when you implement staff. No more than 1 or 2. That's it.
Okay, so by a show of hands, how many of us have a problem with retention of cab members? Because you know a lot of you give events and you'll sign them up and they'll come just to be nice. So by a show of hands, how many have a problem with retention on your cabs? Okay, so one of the ideas was that, you know, as the federal government goes, no, you can't buy food for them anymore, these or that thing. One thing you have to realize is that what made your cab what it was, some of those things you have to revisit. Some of those things are and we have created this systemic dependency on incentives. You know, we've created it. Let's admit it. Everything we did, you got 5, you got 10. Revisit that. Revisit that to let them know, hey, you're more than just a $5 gift card. You're a decision maker in this process. Another thing that we also have to talk about is the composition of our cabs. Sometimes we just can't meet that recommendation. So what do? We apply for the waiver, and then and then Valerie said it, which was more important, make sure it's consumer driven. You have staff members that'll come in just because they want to get home or whatever, and with all due respect, I've been there and I've done that. I have issues going on too. And so you want to do it, but when you actually make the consumer feel that they made a difference or important in this decision, I guarantee you, they may not come back immediately, but they'll come back. One of the fortunate things that I had was my FQHC was run by our municipality, by our city. And some of the things you could do as a 501c3 or homeless healthcare site, you couldn't do when your FQHC or your homeless healthcare site was run by the municipality. So you have to be creative. And I'm not... FQHC, Federally Qualified Health Center. Okay. Acronyms. And you know what? Funny she said that was because another one of our barriers are those acronyms. You know, and you get them to come in. You do everything you can. You sign them up, and then they see all these big packets and they see all these big words. What do? Maybe you should have a focus group on the acronyms of we have to be creative in order to retain these people, which is, I'm one of those people. You have to be creative. And I'm not saying go outside the box, but I'm saying use every nook and cranny and corner in that box, and there will be a level of success.
All right, we got to go to lunch. Everyone, I think, would agree lunch is awesome, right? So we're going to take a break, a 1-hour break for lunch. Lunch will be served in the same place where you had breakfast, which is downstairs past the registration table. When we return from lunch, we're going to continue this conversation looking at the different viewpoints of the players that are essential. So we're going to be talking about the different perspectives of each of the key players that make consumer engagement work. So this conversation is hopefully going to get even more practical and applicable as we come back from lunch. I'll see you all in an hour right here.